Welcome to Contemporary Retirement. Contemporary Retirement is a public interest program focused on the retirement community. Every program has segments on legal, financial, and health issues affecting the retirement community. Contemporary Retirement is sponsored in part by a major grant from the Family Heritage Trust Company.
Contemporary Retirement is sponsored by Family Heritage Trust Company. The Family Heritage Trust Company is an independent bank chartered trust company established by local professionals to provide fiduciary services, including fee-based investment advice, trust services, retirement planning, and tax planning. The Family Heritage Trust Company is committed to client service in our communities. For more information, call the Family Heritage Trust Company at 301-631-5900.
Contemporary Retirement is sponsored in part by a grant from R. Thomas Murphy & Associates, P.C. R. Thomas Murphy & Associates is one of Franklin County's leading law firms, emphasizing estate, trust, elder law, and medical assistance planning.
Welcome to the Is It Legal feature on Contemporary Retirement. Is It Legal focuses on the legal issues affecting the retirement community. With me today is Tom Murphy from the R. Thomas Murphy Law Firm with offices in Waynesboro, Chambersburg, and McConnellsburg. Welcome to the show, Tom.
Good morning, Mike.
You know, Tom, we as elder law attorneys, we help people plan for long-term care. We help them plan for the retirement system. We talk about inheritance and avoiding probate sometimes, not our first priority because expenses for care is more important. But, we're dealing with a very interesting phenomenon. We see this cycle all the time. We're in a cycle right now where nursing homes, long-term care facilities are just really seem to be pounding people as they're talking about being admitted to the facility that there is nothing that they can do. Just give me all of your money.
Mm-hmm. Yeah, I think it's a result of the corporate growth in the nursing home world. And so they make a heck of a lot more money if they're getting paid by your dollars. And there's a whole federal and state structure to protect you, especially for married couples. But they're not about to lead you down that set of rules.
And what we're seeing here is that as we see an increasingly corporate style, we're seeing really just relentless in being pressured to tell you there's nothing you can do. Don't waste any money on a lawyer. You just have to give us all your money. It's all over now.
Oh, absolutely. Yeah, it's just like when you hear the car industry or the car insurance folks, if they're telling you don't need a lawyer, you need a lawyer because they want your money and they're not about to show you how to protect things. It's not in their interest. And of course, that's coming down from the NBA leadership to get those dollars in.
And unfortunately, we see that a number of these organizations are not above telling people stuff that is just flat out wrong.
Oh, yeah.
So for instance, a married couple's residence, both in Maryland, Pennsylvania, and all across the country, a married couple's residence is automatically exempt. No liens, no need to sell it. But we have nursing homes in this area telling a married couple they have to sell their house.
Oh, absolutely. Or trying to place liens, putting notes and mortgages out there in front of them for the institutionalized spouse's share and all kinds of things that just, I don't know if they're illegal, but they're pretty much unethical.
Well, and people say to me, well, you tell me a government agency is not going to tell me how to protect myself, how to optimize. Well, first of all, you need to understand, even the ethical ones are limited by their employers to not tell people the optimum because they want to try to have people use their resources. It's a budgetary issue.
Absolutely.
So I'm not saying they're bad people, but the reality is that we have two former employees of a government agency. We're told absolutely they could not tell people that these options exist. And people look at me kind of shocked at that, but in reality, how many people go to the IRS to get their tax return done?
Well, that's a good analogy, simply because these folks are not geared for that. They're there to protect their employer's interest and do things by the book, and whether you spend your money or not is not their issue.
Of course, we really struggle with discharge planners at hospitals because they routinely parrot the government's position on this. And I understand the government not being totally forthright about these options. It's a budgetary issue. But for a discharge planner at the hospital to silently allow a person to think that the government's position is right is a complete disservice.
Yeah, especially when in many cases, those are the folks we will deal with in protecting their family. And so that's not the first rodeo for them. They know there's these rules and protections in place.
You know, and I talk to them, and I continuously hear from them, well, we don't want to support a private enterprise. And you look at it and say, nothing said you had to tell them to come to our firm or to your firm,
Right,
but you
right.
just need to tell that person there are options out there, and you need to explore those options. And yet they take the position, we're not going to do that. And in essence, they perpetuate the government's position, which is really not in the interest of that family.
Right, and it's somewhat shocking to find out that there are these rules in the book propagated by the government, but they're not sharing those rules. And so there is a lot of confusion for a lot of families.
And because the history is that people don't take advantage of it, they act as if it's an aberration, but it's actually what was intended by the law.
Absolutely, especially in the married couple situation. I mean, those rules are designed to protect the healthy spouse. So you need to take advantage of it.
Tom, as always, thanks for taking time to appear on the program.
You're welcome.
More from Contemporary Retirement after these messages.
Few things in life are as important as family. Leave your insurance orders to us. Write Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
Every life that meets its end leaves a heart for love to mend. Sister, brother, family, friends are left to carry on. When the loss seems more than you can bear, it's nice to know that we'll be there at Douglas A. Fiery Funeral Home. We care.
Call Ed Lough to help put your mind at ease.
Welcome to special guest feature on Contemporary Retirement. This segment focuses on various issues which are of importance to the retirement community. With me today is Paul Sweeney, President of Quality First Insurance. Welcome to the show, Paul.
Good morning, Mike.
Paul, if there's probably been a topic that you and I over the last 12 years have been unable to effectively communicate on, no matter how many times we say it, we have not mastered to have people hear what we're saying. And that is, as we've entered the annual election period for the selection of a Part D plan, you must do it every year.
You have to pay attention. Yep. From October the 15th through December the 7th is your one opportunity to look at your current plan and make the changes for the upcoming year, which is 2018.
And what we can't get people to understand is this is the classic carnival shell game. The insurance companies change the premiums, the deductibles, the co-pays, and the formulary lists, and you have to pay attention.
Yeah, and most people look, unfortunately, at just what the deductible is or maybe what the premium is. You know, they see that the premium last year was $35 and this year it's $36, and they say, oh, it didn't change that much, so I'm not going to change anything with my plan. Big mistake.
Because the primary thing you have to look at, more important than anything else, is that formulary list. Make sure that the prescriptions you're taking are still on that formulary list.
Yeah, and the formulary is a list of medications that particular plan covers, and there's no requirement that your plan has to cover every single medication.
And they don't.
And they don't, exactly. And the formularies do change each and every year. Sometimes it may not change that much, it may not affect your medications, but if it does change and your medication is one of the medications that is no longer covered, and you go to get that prescription refilled after the first of the year, you're going to have a problem.
And the problem is that if you have a medication that's not covered by the formulary list, it doesn't count toward the deductibles or the donut hole or anything else.
Exactly. And unfortunately, many times, those types of medications that are discontinued on a formulary are the more expensive medications. So if you're taking a name brand medication that's no longer on that plan's formulary, and if it costs $300 a month, which is not an unusual cost for a name brand medication, you're going to be paying that full cost the entire year, and it's not going to count towards your deductible or the out-of-pocket maximum.
And you see sometimes the subtle part of the shell game. Perhaps a name brand is in a much higher tier. Somebody's given a prescription for a generic, but the generic has something in it that they can't take it, and they need the name brand. They could have a disaster on their hands.
Exactly, but because again, usually when a generic becomes available, the name brand medication may still be covered, but almost always it gets moved into a higher tier, or what's called a non-preferred name brand drug. So if you had a drug that wasn't available as a generic last year, you might have had a $25 copay. But if there's now a generic available, many times that $25 copay will jump to $50 or even higher as a copay.
And the generic may be zero, so it's really a heck of a difference. You know, we had a major company, one of the most popular plans in the state of Maryland, change their plans in the course of 1 year from going from covering 92 out of the top 100 most prescribed drugs to 52 out of the most prescribed, 52 out of 100, and people had disasters that did not pay attention.
Right, and you have to look. Unfortunately, most people see the premium and they're focused on that, and they say, well, it didn't change that much. I'm not going to really do anything because I don't want to disrupt or rock the boat. But it's important. It's very easy to make a change. It's not complicated.
It's not medically underwritten.
Exactly. So you're going to be able to change from one plan to another, but you have to do it between October 15th and December 7th.
And one of the other things that we hear is people say, well, I don't need it because I'm not taking any prescriptions. Well, a couple bad things happen. First of all, not all prescriptions are maintenance drugs.
Right, and you might get an antibiotic, you might be prescribed a medication after surgery that you have to take, or before surgery you have to take for a while. It's always a good idea to have prescription drug coverage. Before 2006, Medicare didn't have any kind of prescription drug plans available. This is a great benefit. Plans range in costs from $12 a month to $100 a month. So many times, if you're not taking a whole lot of medications, maybe the $12 a month plan is the plan for you.
Well, and the other issue here, of course, is that there's a penalty in the event that you fail to enroll.
If you don't enroll in a plan and you decide you want to do it later, let's say you were eligible 5 years ago, and you decide, well, now I'm taking some medications, I want to enroll in that plan, there's a 1% per month penalty. So if it was 5 years ago, you're talking about paying an extra 60%, and that's not a one-time penalty. That's each and every month.
And it's not 60% of the $12, that lowest cost plan.
Right.
It's 60% of the average cost of a plan.
And the average cost of a plan right now is about $35 to $40 a month.
I will say this, and I've said it over and over again, unless you're covered by an employer plan or a government benefits plan, I have yet to hear a justification for the failure to enroll in Part D that I think is valid.
And we see all the time people that didn't do it, regretting the fact that they didn't. So just pay attention. When you're signing up for Medicare, make sure you get a prescription drug plan.
Paul, as always, thanks for taking time to appear on the program.
Thanks for having me, Mike.
More from Contemporary Retirement after these messages.
Tranquility at Fredericktown Assisted Living and Memory Care provides a warm, home-like atmosphere that promotes daily life enrichment. At Tranquility, our medical director is a geriatric physician. Our professionals support and understand the various stages associated with Alzheimer's and dementia. We have on-site physical, occupational, and speech therapists, as well as around-the-clock licensed nurses. For more information, give Tranquility at Fredericktown a call today, because everyone deserves great care. Let us do the caregiving so you and your loved one can embrace life again.
Guys, I thought you were supposed to be working in the yard.
But Dad, just one more bid on HurleyAuctions.com.
If you haven't visited HurleyAuctions.com, you don't know what you're missing. Whether you're buying or selling, antique cars, tractors, boats, or real estate, you can do it all at HurleyAuctions.com.
Get to know Dr. Carrie Hesley at Diagnostic Imaging Services.
What I find most rewarding is caring for women through our Women's Imaging Center. We have a caring staff that will ease patients through an ultrasound, bone densitometry, breast biopsy, or mammogram. Our health team is sensitive to emotions involved in women's imaging and understands that every woman is at risk for breast cancer. Providing the community with a center that is so dedicated to breast health and the imaging needs of women is something special.
DIS Women's Imaging Center, providing women with progressive care.
Welcome to Contemporary Health Scene. Contemporary Health Scene focuses on the health issues affecting the retirement community. With me today is Micke Brown, registered nurse, Washington County Health Department. Welcome to the show, Micke.
Thank you, Michael, for inviting me.
People sometimes think the health department is about trying to administer care and so forth, which there is a little bit of that going on, but it's really focused on public interest to increase the awareness of health risks to the public.
Absolutely. Our core focus is to maintain a community that's as well as possible. So we have a very strong wellness focus.
So whereas a physician is confronted with a particular affliction, or even if it's a chronic affliction, they're very focused on treating what's sitting in front of them.
Right.
Whereas the health department is looking at the community in a global sense to try to figure out how to move forward to improve health.
And how to prevent problems as well.
And preventing problems is really not the focus of the way our health system delivers care right now.
Correct.
And so you do it in a number of different ways. You do it, first of all, just increasing public awareness.
Absolutely. I think it's really important for the public to understand how they can take control of their own health and ways to prevent illnesses whenever possible so that they have a really strong quality of life.
And then, of course, you deal with some of the illnesses that people are, very concerned about. We deal with some of the HIV awareness and how to prevent it, how to keep it from occurring.
Mm-hmm. Absolutely. We deal with people to help prevent them from getting infections when they have relationships with other people, as well as looking at when there are actually outbreaks of maybe a foodborne illness or something to see if there's a trend in place, and then making sure that we're aware of that and we can find out what the source is and get corrective action.
And making sure that the purveyors of food and other types of consumer consumables are safe.
Mm-hmm. Yes, our environmental health department is very, very busy.
Okay, and now, flu. Now, obviously, when I think of the health department 25, 30 years ago, you were the principal dispensers of flu vaccines, and today that's really not the case.
Right. It used to be that there were massive flu clinics that would be run out of the health department, but now that your pharmacies can be participating in providing immunizations, as well as our family physicians, some of them are doing that as well, we can work as a team to get to a lot more people, I think.
And then, of course, actually the supermarkets in some instances are also doing it, particularly the ones that have a pharmacy attached to it.
Absolutely.
So whereas you were the provider of that, in the end, that really wasn't your business to be in the business of providing, but increasing awareness and perfectly content to step aside and let these other purveyors provide that service.
I think the health department fills a role in trying to backfill the gaps that are in there. So people who can't get access to care readily, don't have insurances, can't get to certain areas as quickly, or may be in the health department for other reasons. We do provide that service, and we do have a very large adult and child immunization program, and we're also out in schools. So it's the health department that's out with the pre-K to 7th grade classes, making sure they're getting their immunizations done for flu as well.
And of course, flu has to be done every year.
Yes, the strains change from time to time. They watch what's going over overseas in China and Asia, and see what is the most prevalent strain during their season, because their season is always ahead of ours, and then they create the vaccine that would most likely cover us the best once it starts to migrate over to the United States.
And of course, sometimes people get the sense, well, flu isn't that big a deal, but part of it is being reduced, although not eliminated, is the fact that there's vaccinations going on all the time, or it could be a heck of a lot worse.
Yeah, what it does is it helps you, if you do get the flu, it helps you be less sick. And if you are somebody who is, very young, very old, have chronic health conditions, having the flu can be serious. It can develop into pneumonia, and it can be fatal. So it is very important for us not to be cavalier about, oh, it's just the flu, because even getting the flu and being out several days can make a big difference from people who need their income from work and things like that.
Well, everybody thinks it's a big deal, so every year we have a nurse from the health department here. We have Nurse Elisa with us today, and she's going to show the coup de grace that this is really not a big deal at all, as I'm willing to be a sacrificial lamb for this. So we'll bring Nurse Elisa onto the set here, and we will show that this is just simply not a big deal. Oops, threw your stuff on the floor, and that's okay. All right, so do I need a blindfold?
Nope, it's going to be quick and painless.
All right. Okay, I got her.
Okay,
All
I'm
right.
just going to clean.
I think one of the secrets is also to keep your arm very, very relaxed when somebody tries to give you any kind of injection, because when you tighten up, it tightens up on the needle and makes it hurt more. And people sometimes are scared and don't realize they're tense.
So when are you going to do that?
All done.
See?
Oh, that didn't even hurt. Well, that's no fun. That's too easy.
Another thing we like to teach is because you have vaccine in your muscle, you want it to go out into the bloodstream as fast as possible. So we teach a technique called chicken wings. Move that muscle, flap your wings 4 or 5 times for the next couple hours, and you will find you're not as sore.
Well, and you don't get the flu from the flu shot.
Exactly. If you get the flu after the flu shot, immediately afterwards, it's because you've already been exposed. It takes about 2 weeks for this vaccine to really start to kick in and work for you.
All right, well, Nurse Lisa, I thank you for coming to administer the coup de grace, and Micke, thanks for appearing on our program.
My pleasure.
More from Contemporary Retirement after these messages.
The Community Foundation has helped create signs of community strength for more than 30 years. Scholarships assist with post-secondary education, and grants support programs throughout Frederick County. Making a big impact. Because of generous donors like you. Add your sign of community strength by creating a fund that supports the causes you care about.
Albright, Crumbacker, Mal, and Itel are a full-service firm that provides elder care services, including managing incoming bills, bill payment, depositing checks, balancing bank statements, and preparing, planning, and filing personal tax returns. Put your mind at ease and call us today.
Welcome to the Making Sense feature on contemporary retirement. This segment focuses on various financial issues affecting the retirement community. With me today is Ed Lough, financial advisor, Northwestern Mutual. Welcome to the show, Ed.
Thank you. Good morning.
You know, one of the key words I just said in that introduction is mutual. What is the structural advantage of having a life insurance policy through a mutual as opposed to a stock company?
With the mutual company, you are an owner in the company, so therefore you receive portions of the company's profits. In a stock company, only the stockholders receive portions of those profits.
So in fact, there's an inherent structural advantage to buy a life insurance policy through a mutual because you get the benefit of the excess profits.
You get the benefit of that, and they're referred to as dividends.
So it's paid into your account. Account grows faster. It's easier for them to grow within that environment.
Correct.
Now, a lot of our viewership is saying, well, that's a great conversation for my child, but actually we find an awful lot of people that we deal with today have a life insurance product that they don't understand may very well never pay a death benefit.
Those policies, I believe, are referred to as universal life, also flexible premium life insurance.
And so you get a statement from them. What's the characteristic? Now, your traditional life policy statement, send a check. What does that universal life policy annual statement look like?
It's got about 6 to 8 columns on it. One of the most important columns to look at is the cost of insurance column, which each year continues to get larger.
It's got a spreadsheet written down month by month showing all kinds of costs and expenses, but most importantly it's showing investment performance as well as cost of insurance.
It is, and I think the rates on those contracts now are in the 4 to 4.5% rate, which are usually the minimums, but it does show the cash accumulation, and as those insurance costs go up in that cost of insurance column, many times that cash value column will grow slowly or in fact begin to go backward.
And you can really tell whether you have one or not is because early on in the policy those cash values tended to grow. When you get these policies that are at risk around the 50s and the 60s, they start leveling off, and in the 70s the cash value deteriorates. What does that mean to the policy if the cash value goes to zero?
Well, in most of those contracts, Mike, if the cash value does go to zero, the death benefit terminates. So
now restate that. Terminates. What's that mean?
Well, it means the policy cancels. You have no life insurance.
So you've paid all these premiums for 30, 40 years, and this policy would not pay a death benefit in that circumstance.
That's correct. It would not. It will not.
And so we find too many people do not understand what that policy actually is. They don't understand that first incremental diminishment of the cash value is almost certainly indicating that policy is headed to zero, because as you get older then you have to buy more insurance within the policy, and once it can't sustain the existing insurance level, it's going down.
And that's that's primarily because of the internal cost of the life insurance going up each year. When you buy a traditional whole life product, that cost is fixed at the age that you purchase it. Not so in this type of policy.
So it's really easy to identify. You get a statement from a standard carrier and it says send $500 and says nothing else, it's probably fine. On the other hand, you get that statement and it's got 3 or 4 pages, it's got a spreadsheet, you're at risk.
You are, and you'll eventually notice that cash will begin to go backwards, and of course that is, sign number 1.
And so sometimes people want to maintain insurance. Sometimes that policy has an inherent tax liability associated with it. Not only is it maybe going to go to zero, but you just can't necessarily take the money out. So if a person decided that they wanted to maintain the coverage, but they wanted to eliminate the risk of that universal life product, how could they interface with you in such a way that there would be no tax and maintain coverage?
They could do a 1035 exchange of all of that cash value.
That's an Internal Revenue Code section, okay.
Yeah, that's correct. And that's a tax-free exchange of cash value from one life insurance policy to another life insurance policy.
And I know that Northwestern has a history of not issuing those policies.
That's correct.
And why?
Well, again, because when a person buys a life insurance policy, they particularly buy it for 2 reasons. Number 1, the primary reason is to have a death benefit for life. And the second reason may be able to access some of the tax-favored cash values later on in life.
Well, and of course, Northwestern understood all along that, you're owned by the policyholders. We don't sell them a policy that has a potential of not delivering what the customer expected.
We expect our death benefits to be there, and they are there at the time that they're needed.
All right, Ed, so if somebody has that thing that's a 12-page document, it means they've got a problem, they need to look at it, they need some expertise to help them with it. How could they get a hold of you?
Well, they can call my office at 301-733-5433.
And you'll go anywhere in our viewing area to help people.
I will do that, yes, sir.
Ed, as always, thanks for taking time to appear on our program.
Thank you, Mike.
Thank you from Contemporary Retirement.
Remember a more carefree time? Leave your insurance worries to us, Wright Gardner. Call or visit our website to learn how we can make insurance simple and more affordable.
These days, it seems like everything's online, and filling out claim forms and receiving and paying bills online isn't always easiest. That's why we at Quality First Insurance encourage you to just give us a call. Let us help.
Hi there, I'm Paul Sweeney with Quality First Insurance, and it's still just as simple. Our offices are open every weekday where you'll be able to call and speak to real, live people.
No detail was missed. I'm so glad that I turned to Quality First Insurance.
I've recommended Quality First Insurance to my friends who've been just as satisfied.
If you're not happy with what you're paying for Medigap, or more importantly, not happy with your service, give us a try. We're locally owned, and we take the time to provide you with the best. We are Quality First Insurance, and our mission is to provide quality products to quality people. Pick up the phone and give us a call today at 800-745-1411.